Contrast-enhanced imaging is vital, but traditional on-site supervision creates significant bottlenecks in care. What if you could cut costs by 30%? Forward-thinking centers are doing just that with virtual contrast supervision, and it's done safely. A key survey found zero negative patient impacts, and 30% of centers reported faster responses. In fact, CMS validated this approach, extending its approval for remote supervision through the end of 2025. So how does this work? We will now break down the financial, patient access, and workforce advantages for you. So why is this shift happening now? It's not just new technology, it's a direct response to a critical industry-wide challenge. A worsening radiologist shortage threatens service availability and creates dangerous delays in patient diagnosis. The old model requires a radiologist to be physically on site, which leads to costly equipment downtime and coverage gaps. Virtual supervision decouples radiologist presence from a physical location, optimizing the time of every available specialist. The most immediate impact is on your bottom line. It directly reduces operational costs for physician coverage. This leads to less overhead, better staff utilization, and greater scheduling flexibility. You maximize your most valuable assets. These operational gains are impressive, but how do they produce better, more accessible patient care? The answer is a change in resource allocation. The core mechanism is one-to-many supervision. A single radiologist provides real-time oversight for studies across multiple imaging sites at once. This is powered by secure real-time audio and video. The remote radiologist has immediate access to patient data and on-site staff. This model requires standardized response procedures and detailed documentation, resulting in a more consistent standard of care across all sites. Because the radiologist is virtually present and focused, data shows response times can be cut by 30% compared to on-site models. So, the mechanism doesn't just save money, it re-engineers the workflow to be faster, more consistent, and more resilient. What does this redesigned workflow look like in the real world? The impact on patient access is transformative. We asked how efficiency improves care. The answer: it breaks the dependence on on-site physician schedules, allowing for evening and weekend appointments. This is a profound benefit for rural and medically underserved areas. Patients no longer face long delays or travel for diagnostic imaging. The system ensures a specialist is always available, on demand. This flexible scheduling removes gaps in coverage and prevents service interruptions. The result: more patients served, more scanner hours used, and better community health outcomes. It turns a bottleneck into an advantage. Implementing this system isn't just flicking a switch. It requires a solid technical infrastructure to function correctly. Key components include high-speed internet and reliable AV devices. All data storage and transmission must be fully HIPAA compliant. Beyond technology, success hinges on rigorous safety protocols. The system must ensure full compliance with ACR and CMS guidelines. The goal is to use technology to create better communication and more standardized care. This is not about removing oversight. It's about making it better. So, when you combine the financial, workforce, and access benefits, what is the larger picture? It's a fundamental upgrade to the care delivery model. That cost reduction we mentioned isn't just a number. It's capital that can be reinvested, a direct result of optimizing radiologist resources. The ability to supervise multiple sites at once is the engine that powers expanded hours and better rural healthcare access. One enables the other. And this efficiency doesn't compromise safety, it improves it. Faster response times are paired with zero negative patient outcomes. You get both. This proves that virtual supervision is no longer a temporary fix. It is a permanent, strategic solution that improves both operations and patient safety. We've seen how virtual supervision delivers on three critical fronts. First, it dramatically reduces costs and boosts operational efficiency. Second, it vastly improves patient access, especially for underserved populations, and it maintains the highest standards of safety and quality. The evidence is clear. Virtual contrast supervision is a proven method to improve patient access and reduce costs. It is the new standard. For healthcare leaders, the question is no longer if, but how soon you can implement this to stay competitive and better serve your community.